Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Here we have images of a 4-month-old lab with bilateral thoracic limb lameness and pyrexia, swelling of the distal radius and ulna with pain on palpation. Let's start by looking at the lateral view. Whenever I'm assessing a musculoskeletal radiograph, I like to follow the ABCDs approach. A stands for alignment, where I make an assessment of the alignment of the entire limb, so much as we can tell that in a non-weight bearing radiograph, as well as alignment of particular bones in relation to each other. In this case, for example, the cuboidal bones of the carpus, or given that it's a juvenile, we can also pay attention to the alignment of the epiphysis relative to the metaphysis and diaphysis. A for alignment is followed by B for bone. This is where, of course, we spend a lot of our time when we're doing the ABCDs approach. When I'm doing B for bone, I trace the medullary cavity and the cortices of all bones on all views. While we're talking about that, I'll take a moment to note a minor and potentially questionable finding in this case. The medullary cavity of the ulna is very slightly increased in opacity. This has a fairly uniform appearance, which makes me think that it's probably an artifact. However, if you were to compare to the medullary opacity of the radius, you can see that it is slightly increased. After B for bone, I look at C for cartilage. Cartilage is a little bit of maybe a simple way of saying what I really want to look at are the entire radiographic joint space and periarticular margins. C for cartilage fits in the mnemonic really well. When I do C for cartilage or assess the joint space, I again look at the subchondral bone plate of the epiphysis of all of the bones, including the long bones and the cuboidal bones. When we're assessing C for cartilage in a juvenile, we also have the chance to assess the growth plate or the physis itself. When I look at the metaphyseal region right next to the physis in this patient, I'm seeing increased opacity and a radiolucent band. On the ulna, you can see the radiolucent band is a much more prominent feature. There's also some periosteal reaction that extends along the metaphysis. I'm going to switch to this view to look at those findings in a little more detail. So here I've zoomed in on the distal antebrachium and carpus. So while I'm assessing the physis, I can see again, we have a radiolucent band on the metaphyseal side of the physis, affecting both the radius and the ulna, although the radiolucency is somewhat more pronounced in the radius. The physis itself, you can see, is actually fairly well defined. So my conclusion after going through the ABCs of this case would be that there's affecting the radius and ulna, some type of a metaphyseal disturbance. To talk about the D and S of ABCDs, D stands for devices, which is not relevant here, but is important when doing an orthopedic follow-up, and S stands for soft tissues. You can see there is a little bit of soft tissue swelling here. These findings together that we see in today's example actually lead me to conclude to a very particular disease process, which has this metaphyseal lucency and irregularity with adjacent sclerosis as its pathognomonic or expected radiographic finding. This is hypertrophic osteopathy, sometimes referred to as a metaphyseal dysplasia. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.